Welcome to Amplify Eyecare Santa Clarita. I'm Dr. Carl Garbus. First, we're going to take a venture into our dispensing area, where we have a nice, spacious area for frames, a very comfortable environment for our patients.
What would be something that you say is unique about your optical compared to other opticals? I noticed it the second I walked in. Does your optical have more than the average amount of kids stuff?
Okay.
Yeah.
Yeah, I could make a comment on that.
A nice selection of kids frames, all this whole wall, and cute selection of stuffed animals too. When somebody comes in to get glasses, what's your philosophy about dispensing frames, lenses? What do you tell somebody if they say, "Oh, I could get them on the internet for cheaper"? What are some of the kinds of lenses that you recommend?
Some of the highlights of coming into a specialized practice is that you're going to get good quality care for maintaining that eyewear. So if the frame gets out of alignment, we encourage our patients to come back in for an adjustment on their frames, but also the warranties that we offer to our patients are very, very good warranties, both for the frame and for the scratch warranties on the lenses.
Okay.
So it's a big, advantage that way.
So especially if they're on the computer and reading and on the phone a lot.
Exactly. And it does have the filter there to block out some of the blue light too.
Cool.
So yeah, it's a nice little design for children.
Great. Okay. Yeah. So let's go into the next room of the...
So right over here on our right-hand side is our vision therapy room. It's one of our vision therapy rooms. And so we see a lot of kids in our practice and a lot of children that require specialty therapy procedures. And so our technician, our therapist that works here, her name is Thelma and Jenny. And they utilize this room to its fullest capacity. We also have a second section to this therapy room, which comes into the back here, where we have some specialized equipment. We have the Sanet Vision Integrator, which is here. Should have taken that off. And we have instrumentation to measure reading, eye movements, and how accurate the eye movements are, which is more spatial. That's what we're working on in terms of trying to develop a better working relationship with the visual system.
Cool. Excellent.
Especially on the road,
It's amazing, right? Yeah.
It's pretty amazing. Yeah. So if that system's not working well, the person can't operate well in a real world situation.
So is that when somebody says they have vertigo, is that visual related? Sometimes?
Vertigo, yes. Definitely vertigo can be you can have vertigo with your eyes closed, or you can have vertigo with your eyes open, and it tends to be worse if they have visual motion sensitivity. That vertigo will be worse.
Mm-hmm. Yeah. Interesting. Okay. You want to show me the next room?
Sure. Now we're in our little waiting area, and we don't try to keep our patients in this room very long. We like to get them into their exam rooms. But it's a nice quiet area to sit down and relax for a minute or two. And one of the finer offerings that we have in our practice is called the neurolens, which is a specialized, what we call progressive prism lens that helps patients who have problems on the computer in terms of comfort and how they're using their eyes when they're on the computer. So it can reduce some of the stress and strain that they feel when they have to spend long hours working on a digital device. So neurolens has been in our practice for many years, and we found it to be a very helpful tool. Come on in.
All right, I will.
This is our reception office, staff office.
You know how to show the back, isn't it?